You're listening to The Drive Home.
Alrighty, gang, it's 4:30 on The Drive Home for a Tuesday. Wayne, Tanya, and Brian back at it.
Indeed.
With a special guest that we've been lucky to have on and guide us through a lot of things and a lot of stressful times lately. Dr. Ryan Jennings, the Chief Medical Officer at HSHS, St. Anthony's Memorial Hospital here in Effingham. Good afternoon, Doc. How are you?
Hey, I'm well, guys. How y'all doing?
We're doing great. And
Good.
Doc, if you don't mind, before we get started, I just want to point out that the movie today in Movie Mania grossed $441.8 million. So hopefully that was a little bit more than just a small movie that only 2 or 3 people watched.
I remember that statement.
As you roasted me on last time.
I was just hoping if I called in at the right time today, Tanya'd give me a new nickname.
I know. Oh yeah. Well, I could try.
That happens sometimes.
You can call me anything.
You're the second man in 15 minutes to say. You're the second guy in 15 minutes to tell Tanya any guy can call her anything.
All right.
So
I'll think of something.
Oh, very good. Doc, how are you?
Doing great, guys. Doing great. Thanks for getting us on this evening.
Absolutely. Always had to do it. I get, we might as well start like we have so many times here with this. I know a lot of folks, it seems like there's a lot more pushback lately, and a lot of folks starting to get frustrated with hearing the numbers on COVID, and then it kind of seems like the numbers stop, and then they hear more numbers. And so last report we had, there were 14 positive cases reported yesterday for Effingham County by the health department, bringing our number to 599 so far here in the county. And there's a lot of other metrics to go with that, but so that's where we are as of right now.
That's correct. And, the big question will be kind of tomorrow's activity, I believe, is when the governor's next major announcements are around it. And, we were put on the warning list along with several of our surrounding counties. If, tradition holds true, really, and especially given what they know about the contact tracing, which has identified most of these are related to large events where social distancing, masking, those types of things were not necessarily enforced or honored, we would expect additional mitigation strategies that are directed at that. So I don't know what they will put forward, but I suspect it'll be something that focuses on reducing the number of people at large events and probably shortening some hours of places where folks gather. So similar to what they did in Region 4 with, reducing the hours of bars and restaurants, those types of things. The good news in the new mitigation strategies is they are trying to use the information that they garner from contact tracing to then give direction on what makes sense as a potential intervention as opposed to just globally shutting things down like what they did, previously. But the bad news is there's still only so many strategies that you can use, and at some point that still affects closure of businesses, reducing hours of operations, moving, things outside. Outside's beautiful right now. Well, it's raining, but it's beautiful right now for outdoor activities normally, but in a couple more months, this outdoor stuff isn't going to be very funny anymore.
No.
Yeah,
Correct.
No. Yeah.
Well, and I guess since a lot of the restaurants and the venues that had to, basically social distance and go outside with tents and stuff for their customers, maybe they will put some heaters and such out there as well. They're very creative.
They are, but if you enclose the sides, then now you're inside. So it gets a little difficult to figure out exactly how to manage it, and unfortunately, some of the limitations on the total volume that might be allowed as far as reduction in seating capacity becomes an unsustainable volume to maintain operations. And so, again, this idea that we really need to flatten the curve back out, and so folks, as painful as the masks are. They definitely blunt the curve, and as painful as it is to try to avoid some of these large gatherings, that's going to be essential if we're going to avoid what could turn into, again, the closure of businesses and mitigation strategies that will potentially jeopardize the financial well-being of those companies long term.
So, Doc, not to circle the wagons back here, but you made, what you said a few minutes ago, you're expecting the governor then tomorrow to possibly add some additional things that tighten up things around here because of the spike that we're seeing?
That's correct. So the percent positive testing has stayed higher than what the threshold is, which is what led us to being on the warning list. And again, when you hit that level, then they give you a couple weeks to see what goes on with it. And then if it's continuing to stay at that level, they put in additional mitigation strategies. And if that persists, they're also looking at it then in 2-week intervals, which again is kind of nice that they're kind of going stepwise and being kind of judicious on what those strategies are. But I would anticipate some direction. When they put us on the warning list, they basically said, get something done, and they didn't put forward any mitigation strategies. Now the time has passed, and I suspect we'll have some. And unfortunately for Region 4, which is, the Metro East area, they have had persistently high levels now consecutively, so they'll have further mitigation strategies. So we anticipate to see that area have to move to outdoor seating, reduce the seating capacity even further limitations on hours, et cetera, which, again, it's incredibly hard on businesses.
Absolutely, it does, yeah. And especially this time of year when things are starting to cool off and, a lot of folks want to get out and do things. And, I mean, if there's a time for outdoor seating, I guess that is one good thing, is that it won't be 105 degrees outside here, hopefully, for
Yeah, normally I'd be having a Labor Day party, but, as much as I enjoy a good party, common sense says now's not the time to have a few hundred people in your backyard. So,
good point.
Well, not to hijack this whole thing, but I have to ask you, Doc, to that end, though, what would you say to folks? I mean, I know I cannot even imagine. My wife and I got married back in 2015 on the 4th of July, and what would have been the middle of all this. So people now that are planning this and people that have had, there was a couple of big weddings last weekend. What would you say to folks that are trying to plan these events and they want to have them anyway, but what do you say to that?
Well, I think the importance of the event for all of these things is very much around the celebration of the couple and what they want to have between each other. And you can have the big party with everybody else later. I think one of the things that we've experienced during this tragedy has been seeing that with funerals and, not having the ability to gather even around the grief and loss of an individual, but then seeing folks figure out ways to have a very close-knit group of folks be there for that portion of it, and then at some point on down the line have some celebration of life for that individual. So, there's ways, but and I know it's difficult, and certainly trying to again move stuff outdoors where it can help to do that, even if there's a very intimate portion of it in the chapel part, and getting the rest outside. If you're going to have larger numbers and spacing people out, it's just critically important. And of course, wearing the mask, hand washing, sanitizer available, those types of things, are just paramount right now to our success. And with the uptick that we're seeing, we're once again, unfortunately, faced with decisions at the hospital around having to revisit, visitor restrictions, because those had been gradually lifted, to a certain point. And with what we're seeing now in the community, we're going to have to think about, can we have that many people gathered in the room, and in the facility, and certainly really being extremely urgent around the importance of our visitors wearing masks when they're in the building at all times, and even asking patients if they're able to tolerate a mask to please put their mask on when they're in bed, because you still have folks in there that are there for something unrelated to COVID, but they might be an asymptomatic carrier and expose other folks accidentally. So the attention around it, when you see such an increased prevalence within the community as a whole, becomes really important. And I just keep harping on what we risk for our businesses, because the healthcare piece, again, we've still been pretty lucky. We are seeing many more hospitalizations, and we're certainly seeing a much increase in the number of visits to the emergency room with what appear to be COVID-type symptoms, much more respiratory-related symptoms. But we've not had too many hospitalizations, but we are seeing a lot more than we did see. That's discouraging.
Now, I have some friends that, even, back several weeks, when Wayne was sick, and he had all the symptoms. I have other friends that have all the symptoms, and they think it's COVID. They go get a test, it's negative. Is it just, did they go too soon? Would they have been positive if they would have waited a little longer? Or is this just something completely different that's out there, another virus that's out there?
It's very possible that your first comment that it was just early and they did not test positive, and had they waited, they might have. I will tell you right now, because of the technology that we use for testing of certain cases that detects more than just the coronavirus, there's actually a pretty nice outbreak of a rhinovirus out there right now, which is just a normal cold virus. But right now folks have heightened awareness of even those types of symptoms, and so occasionally they're being tested, and we're seeing a pretty good cluster of rhinovirus. What we've also seen, though, and what gives me pause around this fall, is we're seeing folks ending up in the hospital because they have both. They have rhinovirus and they have coronavirus, and either one alone, they may have been okay, but the two together is more than they can get through, and so they're ending up hospitalized. And when you start thinking about what happens every fall, that's influenza, and I'm very concerned that we're going to have folks coming in that have flu and then get corona, and the two together, is just going to lay them out, and we're going to end up, with folks in the hospital at a much higher rate than what we do presently. So it's going to be a good year to get your flu shot, update your pneumonia vaccines, pertussis, whooping cough vaccine, those types of things.
Dr. Jennings, to take a look at something on the national level, recently there was I don't know if you'd call it not a correction, but maybe an adjustment to some statistics regarding COVID and COVID-related deaths. And there's a lot of feelings about that in multiple ways regarding, things that were classified as a COVID-attributed death to maybe now a COVID-related death or things like that. And you could probably spend an hour on that topic alone, but would you be able to provide any clarification on what you know of these? I think it was adjusted from the CDC, and maybe a different way that they're looking at that, or just more information that they have?
Well, some of it's driven, and we've struggled with it even locally, not particularly around death, but just the concept. It has been limited availability to definitively test. And so, occasionally there's scenarios where people have a presumptive diagnosis because, if it looks like a duck and quacks like a duck, and they're categorized as a COVID-like illness and a COVID-related death. And as they've then looked at some of the other seropositive rates, looking at the blood testing and titers and things like that, we're kind of learning that there's an error curve there, and so so there's going to be some correction to the data, but when you're talking about something that's already taken almost 200,000 American lives, if they were half wrong, it's still one of the deadliest epidemics in United States history. So, even if 50% of it's wrong, you still can't deny the fact that this has killed more Americans than, any influenza outbreak since the 50s.
Well, Doc, and to that end, though, if someone had heart disease and they got COVID, okay, I know this has been a big argument with what Brian was talking about. If they died COVID would be a contributing factor, which is called comorbidity, right?
Correct.
Wow,
Okay.
Wayne, I'm impressed.
That's a big word, Wayne.
Wow.
Thank you. I appreciate that. But to that end, though, if the argument from some of these folks is, well, now COVID has only killed, 6% of Americans, so why are we making such a big deal out of it? Well, my argument would be, well, what about AIDS? Because if that's your argument that COVID has only killed 6% of America, to that end, AIDS didn't kill anybody. It was getting pneumonia and your weakened immune system with AIDS. It seems like such a silly argument to me that we've got people that are sick and they're dying. Maybe not everyone in the county is sick, but we've got people that are sick and some that are dying. There are things that we can do to mitigate this, and some people seem really resistant to that for some reason.
Well, I think that's very well stated. At the end game, everybody dies of cardiopulmonary arrest.
Good point.
Yeah.
So,
Okay.
I mean, that's the end game. When that stops, you're dead.
Yes.
But there's always something. Hopefully, not. Sometimes we don't know, but there's something that led up to it. And so, even when you have somebody that has chronic heart failure, and they've done okay with it and lived with it for a long time, and then ultimately acquire COVID and then they die, presumably the real cause of death was COVID. Yes, they had a comorbidity, and yes, they were, as somebody that was at risk of death. But the question then becomes, what tipped the balance? And if that happened to be COVID that tipped the balance, then it's appropriate to say that they died of COVID. But otherwise, everybody dies of just, cardiopulmonary arrest. That's all. That's eventually what happened.
Good point.
Okay.
Well,
All right.
Doc, as always, we went long with you, but we appreciate it. You're a wealth of knowledge, as we've said many times, and we cannot thank you enough.
Yeah, tough times right now, though, guys. So be wise, keep yourself safe, hand washing, masking, distancing. Try to take it easy over the holiday weekend here, and we'll all emerge from this thing coming into the beautiful fall.
Hey, Doc, and if I can tell you one thing real quick here, not to add to this, I want to throw a shout out to St. Anthony. My niece ended up in St. Louis over the weekend from COVID, and she went to St. Anthony first, and you guys did, from what I understand, a tremendous job making sure that she was okay, getting her transported, and hats off to the staff at St. Anthony. I know you guys are going through a lot right now, and it's a stressful time, and you guys are doing an excellent job trying to keep everybody safe.
Boy, I appreciate that, and I think that message of making sure that you do come in and get things taken care of when you're sick, because it is the right place to go. It is safe, and it is the right place to go in an emergency.
Absolutely.
All
Dr.
right.
Dr. Ryan Jennings, Chief Medical Officer of HSHS St. Anthony's Memorial Hospital in Effingham. Always a pleasure to talk to you. Looking forward to it the next time, too.